Tonight, Southeast Texas healthcare workers face an uphill battle trying to convince more people to get vaccinated.
You know, the reasons vary from people who think they don't need the shot because they already had COVID to others who don't have rides to get to vaccine clinics. You know, 32% of Texans are fully vaccinated, but as you can see, Southeast Texas is way behind. You can see only 19% of adults in Orange County are vaccinated.
12 News reporter Amelia White explains what's being done about it.
Jordan Dage, the numbers are especially concerning for medical providers and hospitals who serve our rural areas. They know it's going to take tough conversations to change people's minds.
I mean, I guess in a few cases we're better than we were this time last year, but
Orange County resident Timothy Betts still has his hesitations about rolling up his sleeve.
I mean, in my opinion, you just don't know what to trust. You know, I mean, like the Johnson&Johnson vaccine, you know, I read a deal, and I mean, I know it's not that many of them, but, you know, I'm not so sure I'm willing to be one of those that didn't make it.
Texas Organization of Rural and Community Hospitals CEO John Henderson hears that kind of hesitation all the time.
Yeah, my reaction would be a mix of frustration and fear. I mean, COVID has been taking such a toll on these communities.
He says we have more work to do than people think. Communities like Newton and Orange counties have vaccination rates under 20%.
Well, you know, we talk about vaccine hesitancy and all the reasons that contribute to that around, you know, underserved minority populations, education level, income and poverty, and even political affiliation.
The Dean of Clinical Affairs at Baylor College of Medicine, Dr. James McDevitt, says it takes intentional and respectful dialogues to change people's minds.
If this year has taught us anything, shouting at each other doesn't solve any problem.
Henderson hopes medical providers can change the narrative by sharing positive stories about the vaccine.
We're trying to start talking in terms of vaccine confidence instead of vaccine hesitancy, because these skeptical communities, or they don't need a lot of reasons to decline the shot.
But for Betts, he simply says he just needs more time.
I'm just not 100% convinced that it's the thing to do. And I mean, I'm not even real sure I'm at a 50-50 mark.
So moving forward, we may see two things happen. Vaccines coming to you, maybe even where you work, and more health officials talking about the vaccine with confidence. I'm live in Beaumont. Amelia White, 12 News.